Okay, Naomi, thanks for taking some time to talk with us today. Tell me a little bit about what your symptoms were like and your life was like with your headaches when you came to see me.
When I came to see you, I basically was incapacitated. I like to say I really had no life anymore. I couldn't take care of my 2 and 4-year-old, couldn't read to them. I was in chronic pain from the back all the way to the front on one side of my face. I had migraines pretty much daily, on top of just chronic pain daily. I was withering away because I was so sick, couldn't work out anymore. I had no life.
And how severe were the migraines on a scale of 1 to 10, would you say?
Oh, 10 to 10. 10 out of 10. Couldn't do it. I mean, they knocked me out for days.
Right.
Yeah.
And so you tried a number of things, obviously, before you came to see me, and unfortunately didn't have a lot of success. Mm-hmm. And so we did a bunch of nerve blocks in the back, and pain went away temporarily. And so then we decided that we were going to go ahead and remove the occipital nerves.
Yes.
Tell us a little bit about what the surgical experience was like.
The surgery itself, I mean, you don't remember it, so it was very comfortable. I mean, I don't even remember driving home, really, or being driven home. And the first day or two right after surgery was very comfortable. I mean, that night I was eating, no problem. And then about 4 days after, more pain started to kick in, but I had medications, so it was controllable. Okay. And it was definitely tolerable, comfortable. I just rested as much as possible. I was very tired, but
and then the next few months, because your recovery's been tough and it's been long. Mm-hmm. So tell us a little bit about that.
The recovery process is a roller coaster. Mm-hmm. It's very up and down. 1 minute you're hopeful, the next you're thinking, oh my gosh, did it work? Your pain dips and you think, wow, this is it. Then it goes back up. So the recovery is definitely tough. It's emotional. It's physically challenging. You're exhausted from that all.
Right.
So it's tough.
And so when would you say you first noticed a real benefit, like you maybe turned the corner?
Probably at about 6 months. Okay. I felt like I made a big leap forward, and I just really started noticing hours of pain-free, and it just got progressively better from there. So yeah, at about 6 months, I really said, okay, I think, there's been quite a success in the surgery.
And so now you're 9 months after surgery, and what are things like now?
Oh, I feel like I have me back again. I feel like my kids have their mom back again. I can read to them again. I can plan to go out with friends and plan things, trips with my kids again. So I feel like I have my life back. Not every day is perfect. I still, experience little flare-ups and migraines maybe once every 10 days or so. But everything is totally controllable with very little medication. And it just goes away and I can just proceed on. I mean, it's been life-changing.
Great.
Yeah.
So would you do it again if you had to?
I would do it again. I don't know if I'd want to go through the recovery again, but that's part of it. And if I knew that this would be the outcome, you just stick in your mind. You just, there's light at the end of the tunnel. So yeah, I would do it again. Definitely.
Well, thanks for talking with us. Really appreciate it.
Thank you.